This is Mike with Relational Intelligence, and I have with me here today Kristin Conti of CareGuides. And Kristin is a family nurse practitioner and here to talk to us today about her new project. So welcome, Kristin.
Thank you, Mike.
You're welcome. How are you?
I'm well. How are you today?
Doing fantastic. So tell me a little bit about CareGuides. I guess I would maybe kind of just tee it up a little bit and say, you know, in my experience in being a health insurance broker and advisor, what we're experiencing with our clients and their employees is just, you have an employer that, they might be spending $500,000 or $1 million or $2 million a year on health insurance premium, and yet the employees, the participants, are having what I would say is increasing difficulty in just getting through and negotiating the healthcare system, right? Whether it's getting a claim approved from an insurance company or even just getting enough time with a doctor. Mm-hmm. And so, when we started talking about CareGuides, I thought, wow, that's really, really powerful. But I'm not a practitioner, so there's like, we can only do what we can do on our end, and then there's this certain opacity where I can't see beyond that. And so I'm really excited to, kind of hear about CareGuides, but maybe before we go there, just share a little bit about, kind of your background and how did you get into the field and your story.
Yes, so I've had similar experiences. I've been a nurse for almost 20 years. I started out in critical care, and then for the last 3 years worked as a primary care provider for the Air Force. And so I think during that time...
Thank you for your service.
It's an honor. During that time, I think you see a lot of disparities that people are facing, even in your own clinic, right? So let's say, for example, you come in, we have 20 minutes from start to finish, and that's from the time you check in to the time we take your vitals, ask you a little bit about why you're there, address your issue, put in the orders, and chart the note.
Wow.
So
that's a lot.
That's a lot to do. That's
a
big ask in 20 minutes.
Mm-hmm.
And we're all trying to do this because we have metrics and other things that might, for example, in the civilian sector, determine whether or not you get reimbursed for the encounter. But it seems to me like it starts to becoming at the expense of the patient, right? Mm-hmm. And so you're just kind of using these quick check boxes, like how's your sleep, how's your diet, how's your stress, yes,
right.
yes, but you're not really going into detail. Mm-hmm. And those are the determining factors, right? I can write you a prescription, but really the things that are going to change your life are lifestyle interventions, right? Figuring out how to use food like medicine, talking about why you're taking a prescription or what that journey looks like long term. And I think because we don't have the time to discuss those things, ultimately there's a lack of understanding, and it might change how engaged you are as a patient and the way it impacts your overall health.
Yeah, and it feels to me like, we now so often... It used to be that we Googled something. Now we just have Instagram as telling us, what we need to get from our doctor,
Yes.
And so it almost feels symbiotic from the patient's perspective that, I want to come in, I'm not feeling right in this particular ailment, and I just want to go in and get my prescription and leave.
Yes.
And there's this treadmill aspect of it that I think now, at least in some popular media, it seems to be there's a growing awareness that, hey, maybe there's other things that we should be looking at, like food and sleep and alcohol intake and all of exercise and all of those things.
Yeah.
So in that clinical environment, I think if I'm hearing you right, it's almost impossible to really get down into that level with somebody in a 20-minute period of time. Is that
Absolutely. It's very hard to do. And if you have multiple issues that you'd like to address, maybe it took you 4 to 6 weeks to even get that appointment, it's hard to figure out what does the path look like. Can I address all of those things realistically in that time frame? You don't want to keep cutting somebody off or deferring them out to a later date because those are priorities in their mind, in their world.
Yeah.
But to your point, I think we're almost overly inundated with information, and what we don't know is how to use that to our own advantage.
Yes.
What's right for me? What fits one person's needs might not be right for the next person. And so I think it's kind of our responsibility not only to help people figure out what's causing their issues, but how to optimize the resources available to them to get what they need out of the healthcare system. Yeah. Whether that's a prescription or a diet or an exercise plan, it really just depends.
Yeah. And so how do you envision CareGuides bringing some, remedy to that whole process or environment?
Yeah, so our primary focus is on offering 6 different services. One would be care navigation. And so you're just trying to figure out, perhaps when would be an appropriate time to get a second opinion.
Yeah.
Or I'm faced with this new diagnosis and this was the treatment recommended, but I don't seem to be responding to it. Or maybe it's something as simple as, why don't you download the app that's associated with your insurance company so you can figure out what benefits might be covered. And then that kind of escalates, right? So then we also offer personalized coaching, and that would typically start with a 5 to 7 minute survey. But to your point, instead of having this really extensive survey that asks you 70 questions and takes you forever to fill out, nobody has the attention span for that anymore or the time for it, right? And so this is more personalized. It's not like, when was the last time you were at the doctor? Tell me how many medications you're on and the dose. It's more like, what are your healthcare goals? What would you like to share with me about your healthcare? How are you sleeping? How are you eating? How are you exercising? What's your perception of health? And that way we can really personalize what we're giving people. Now, we'll also address things like preventative care, right? Because you ultimately don't want somebody to get sick.
Yep.
And then if you do have any chronic conditions, looking at optimizing your care. You're in and out of the doctor's office so fast sometimes that you don't even really know why you're taking something or what it's doing for you. And I think having a better understanding, for example, of why you're on this high blood pressure medication, do you have to be on that forever? Is there anything that you should or should not eat whenever you have this kind of condition? Those are the kind of things that we can help. Because we're not going to necessarily diagnose or prescribe or anything like that, or even undermine the existing care team. We're there to optimize the care they're receiving and make sure they have a better overall understanding.
Yeah, and I think that chronic condition management, if we look at just the overall health of the population in the U.S., we are not getting better. We're getting sicker, as a nation. From a practitioner standpoint, what have you seen? What are some of the things that you've seen in, chronic condition management that you're hoping to, alleviate or address through CareGuides, whether it's, having multiple doctors and multiple prescriptions, or people not adhering to, what's been prescribed, or perhaps even missing out on, the idea that food is medicine. So how do you see being able to attack some of those, chronic conditions?
Yeah, I would say, for example, sometimes we think the only way for an autoimmune condition is to prescribe a medication, but perhaps there is an opportunity to explore an anti-inflammatory diet or some other way to manage the condition if the patient is open and committed to that endeavor. And you might be able to put them in remission without having to worry about the side effects of some of these caustic drugs.
And have you seen that personally? I mean,
yes.
Okay.
Yes, yeah. I think, it's... The other component of this is because of the time constraints, right? Like, people aren't trying to shortchange their patients, but if you're put in a rush to just get through the encounter, it's easy to dismiss things that might be very telling otherwise.
Sure.
I think back to a friend who was sharing her story recently about how she went in, she had 3 children, she was suffering from this almost debilitating fatigue where she felt like she couldn't parent at the level that her children needed her. She was bloated, she just felt like she was so run down, couldn't figure out why. When she went in, they did some kind of general labs, but ultimately were like, you're a mother of 3. This is to be expected. And what they didn't realize is that she actually had celiac disease. So the moment she stopped eating gluten, all the symptoms resolved and she was fine. And so I think sometimes, again, if you're rushed through an encounter, it's easy to just say, oh, that's to be expected, and kind of dismiss somebody's concerns. But if you really took the time to listen, if you had the time to be more invested, you might realize that they're telling you something more. And you wouldn't know that without doing the workup, right?
Wow. That's powerful.
Yeah.
And she was able to overcome all of that or most of that through diet change?
All of it, yeah.
Wow.
Everything resolved.
Wow.
Yeah, and that was kind of interesting too, because her child was later diagnosed with the same condition and it manifested in similar ways. But one of the symptoms that you can have from celiac is headaches. And so I think, they go into the pediatrician and the standard route is to do labs and an MRI. They're looking for a tumor.
Sure, absolutely.
But in reality, she also had celiac disease. And if her mom hadn't had that experience and asked for the testing, that might have been overlooked, right? You would have been doing this whole workup. It would have been coming up negative. Here's this poor kid having these terrible headaches. And so it's kind of interesting. You really have to take the time to listen to what's happening to people, because deep down inside, she knew there was a problem, right?
Yeah.
And she just needed the outlet to explore that with somebody who was willing to take her, to go on that journey with her.
Right.
And so I think that's one way that you could talk about, chronic condition management. But that also plays into one of the other services we offer, which is holistic care, right? We're looking at the whole person.
Yep.
What other things are impacting your sleep? Is it your stress at work? You know, if it's maybe you're not working out because the gym is 2 hours away. Now that's kind of like an exaggerated example, right? But there's lots of built-in barriers to why we can't achieve our goals.
45 minutes though after a long day at work.
It's almost impossible, right?
It's really tough. Yeah.
Yeah.
Yeah, for sure. So we talk about the whole person, you know, it's sleep, it's diet, it's activity and exercise, and probably community and some mindfulness in there as well, kind of the whole kit and caboodle, if you will.
Exactly. And it's easy to just recommend these generic things like you should be doing X, Y, and Z, but that might not fit into somebody's lifestyle. Mm-hmm. So you have to figure out what's important to them and meet them where they are. Yeah. And that's really the only way to be effective.
Yeah. You know, one of the questions I've always had, you read a lot about metabolic syndrome, you know, and kind of on the way to that adult onset diabetes. What is metabolic syndrome, or how is that defined, and what can people do about that? I would think that is largely diet related as well.
Yeah, there are some things that can make you predisposed, but to your point, there are some, it's also heavily influenced by your lifestyle, right? So if you're eating a lot of processed food, a lot of fast foods, basically it will change the way that you metabolize calories, right? And with the way you utilize and process energy, and it can lead to other comorbidities, right? So as you start to gain the weight, and as you're not metabolizing food as quickly, then your systems, let's say, they become more inefficient, right? And you start to become more prone to developing disease. And there's a specific set of diseases that are typically associated with the condition. But
interesting. Yeah. I mean, you know, just as I age, I mean, you can kind of feel it. You know, I'm not as hungry as I used to be, or maybe don't have as much energy in the gym. And there's, you know, probably a lot of things, you know, contributing to that. But
yeah, and there's all kinds of foods that you eat that you might not realize. Maybe it's causing gut dysbiosis or some sort of systemic inflammation. And that's the reason that you're tired every day. Or maybe that's the reason you're not sleeping so well. So there's a lot of factors that play into it.
Yeah, and I feel like, you know, as a nation and society, my hope is that we're on the precipice of sort of an awakening, but there's a lot of education that has to happen here. And I know at Relational, as it, you know, we think about us as 401k advisors and benefit advisors, we're always doing our best to try to educate participants and employees on what's good for us, not what's good for them, and meaning them being either, you know, credit card companies or finance companies where they're looking to boost their profits. And much like, in my opinion, you know, big food and big pharma are doing the same thing. But we as individuals, we have to, I think, band together and share this information and do one of the hardest things known to man, which is to change behavior, especially in the onslaught of all of this, you know, information that's coming at us. So it's not an easy task, but it's a really important one, I think, for where we're at in our development as a society, it seems to me.
Yeah, absolutely. One of the last services that we didn't really touch on yet would also be claim advocacy.
Yes, I was going to ask about that. Yeah.
Because as you're going through all these, so there are times, whenever I was explaining this earlier, whenever you're documenting something in the health record, the code that you use might not always translate to the exact same thing that an insurer is seeing. And I think that's a perfect example of sometimes how there's a breakdown in communication, even in these systems that we're trying to basically utilize to make ourselves more efficient.
Right.
And as a result, the claim could get denied, right? One good example is something that we were dealing with recently where a claim was approved for a procedure to remove a cyst, but there was a second part of that procedure where they were going to use bone grafting or put in cement to create stability and promote healing after the fact. But because of the way it was coded, it looked like it was for a different condition, which is not the standard of care. So that part of the claim was denied.
Yeah.
So I think just making sure that, you know, just kind of going back through and figuring out, okay, what condition do you have? Why was this recommended? What interventions have you done up till now? Would this be a standard of care? What's the likelihood of success if you have this intervention? And so looking at the whole picture and then just kind of figuring out where the breakdown in communication is generally the easiest way to solve that problem, because our end goal is to get people the care they need. And I think that is really everyone's intention, whether that's the caregiver or the insurance company, the surgeon, whomever it is.
And I think a lot of times, and I'm not, you know, defending the insurance industry here, but I would say that in many cases, it's not just the insurance company's fault. It might just be a miscommunication between the doctor's office and the insurance company as to, how something should be covered. And I think that, many people might say, well, you should just cover everything. Like if the doctor writes it up, it should be covered. Well,
you can't do that.
You can't do that. I mean, really,
it's just not realistic.
Like costs would go up like 40%. Like is a real practical number. So if we were to say, insurance premiums, they are very expensive, but they also reflect the claims, and the claims reflect the underlying health of the population, right? So if we want to try to chip away at the ever increasing healthcare cost, we really need to try to improve health. And that's a big lift.
We have to be mindful of how we spend our money, right? And not everybody needs an MRI, because even this diagnostic testing, even though it'll give you a name, it's not going to take away your pain or alleviate your symptoms. So I think we just really have to consider all these factors, and sometimes offering a little education can go a long way.
And one thing that you said a while back really got me to thinking. There's kind of two things that are on my mind in tandem. One is standard of care, and then the other is liability and protection from lawsuits. And it strikes me that perhaps, I don't know, but from your perspective, do you feel like there's some level of medical activity that happens just to protect the doctor's office or the hospital from, potential lawsuits, meaning, I feel like I have this, and we have to now check these boxes, because if we don't check those boxes, then we could be sued.
Liable.
Yeah, right.
Yes, that definitely happens. I think we're all, to some degree, practicing defensively. I wish that wasn't the case, right? Because then you'd almost find yourself in a predicament sometimes where you're ordering tests that would normally be indicated, and maybe you're traveling down a rabbit hole, but you have to do that. It's kind of what they call a CYA.
Yes, and we do know what that stands for.
Yes, yeah. Won't spell that one out.
Right. So if we look into the future a little bit with CareGuides, what are some of the positive impacts that you hope to make, like on a little bit of a broader scale over time?
Well, one thing I hope that employees start to see that the employer is purchasing this as an investment in them, saying that we think of you as a priority, and we want you to be able to be in a position to prioritize your own health. And our hope is that bigger picture, that we would drive down costs by ensuring that people are able to utilize their health care and really optimize any treatment plans that they're currently participating in, and learn more about lifestyle medicine, using food like medicine, even something as simple as, what supplements should I take and how do I know how to pick the right one? You don't necessarily have to be sick in order to live better, right? Because we also don't want you to get sick.
Well, it's amazing you say that, because when I think about, like even my morning ritual, right? I take my vitamin B and I take my fish oil and I do my vitamin D. And as I'm popping those pills, I'm like, I kind of don't, I know what the label says, but I don't really know the manufacturing process of that stuff that, I'm taking. It's supposed to be good for me, but I try to buy high quality, but I personally, I haven't done the research on that. Like, how does one even go about making sure that they have, because those supplements generally, they don't go through an FDA approval process, right?
Exactly. So, unfortunately, they have, when I say they, the general they, some of these quality control...
Those people?
Yeah, those people. They have done kind of like what they do is studies where they randomly take a product off the shelf and then test it, and they found things like Prozac and crayon bits and some of these over-the-counter supplements.
Oh, wow.
So I think what we forget sometimes is, not that everything has to be FDA regulated, but whatever else is being manufactured in that facility can end up in your supplement. And so there are certain clean label things that are just kind of like, okay, I know this is a gold standard. This is something that can be trusted. This is a good, clean source. That's one of the things that we write about in CareGuides, is teaching people how to identify that. What we used to say in the military is, if the NCAA can take it, then so can you. Just so that you would know, because they have
that's good.
Drug standard testing and things like that. You don't want to randomly come up positive for something that you're not taking whenever that was never your intent. Maybe that was your protein powder, and you're not really on Prozac, right?
Yeah. Although it might be kind of nice with the fish oil, I guess. I don't know.
I feel like this really improved my mood.
Yes, right. Wow, this fish oil is amazing.
Exactly.
So in the process, so if I'm an employee and I get an email from CareGuides and it says, hey, welcome, Mike, we'd like to invite you to do your, wellness roadmap. And I go through and fill it out. What could I expect next? And so from both the participant standpoint and then also from your standpoint, you're looking at, 100 or 500 or 1,000 employees, and they're all going to fall into different, health categories. But what should the participant expect at that point?
From the participants' side, what they would see is this kind of welcome email. This is who we are. This is what we offer. A pretty simple link that'll take you directly to the survey. Once you submit the survey, I'll receive a notification, and then I can thank you for your time and investment, which will give you another link attached with that thank you email so that you can book your one-on-one session. And that's the beginning of the CareGuides journey.
Awesome. And then from there, just kind of it really is dependent upon sort of what evolves in that conversation and where you kind of want to take the patient.
Absolutely. It really just depends on the individual after that.
Well, hopefully that's exciting for you to be able to have a little more freedom than just what, in that clinical setting.
Absolutely. It's very exciting.
Fantastic. Well, Kristin, thank you so much. That was really eye-opening, and I hope that a lot of employees and participants get to experience it.
Yes, me too.
Yeah, thank you.
Thank you for your time, Mike.